If you like my videos, please subscribe to my channel, and this is my channel name, Dr. Javed Iqbal Khokhar, Lectures on Forensics. Thank you very much. Hello everyone, I am Dr. Javed Iqbal Khokhar, Professor of Forensic Medicine and Toxicology. Continuing with the lectures on autopsy, this is 31st lecture on this topic. Today, I'll discuss what are various hazards of autopsy. And the learning objectives of this lecture will be that we will learn what are various hazards of autopsy, what are physical hazards, chemical hazards, electrical hazards, infective hazards, what is necropsy wound, and what are various immunizations which have to be done to the staff, and how can we prevent these hazards. Hazards of autopsy are important to discuss because we are dealing with biological material in a specific environment. So the environment and the dead body are likely to have some hazards which are going to be transferred or having an impact on the autopsy surgeon and the staff. So when we study them, then we will be able to design the suite of autopsy or autopsy lab in such a manner that we can avoid them. Dead body can be hazardous because of transmitting various infectious diseases. And the environment of autopsy lab includes building, water, electrical equipment. Most important, these are. We are dealing with various chemicals and other equipments which are involved in the cutting, in the various other procedures. So all these are going to have an impact on the staff and the autopsy surgeon. So the hazards can be physical or mechanical hazard, electrical hazard, chemical hazards, and hazards by the ultraviolet light. Physical or mechanical hazards can be a prick or cut wound by sharp instrument. Floor, especially when it is wet, may be slippery, and this can result in soft tissue injuries, abrasions, cuts, and laceration because of the slipping of the staff. Sometimes it may lead to bone injury, fracture, dislocation, or backache or sprains. So due to handling of the dead body, the staff may sustain pain, sprains, and strains because of the lifting of the body and transporting it from one place to the other. Then the electrical hazards. As various electrical equipment and instruments are being used during autopsy, like the bodies are kept in freezers and we have to open it and put the bodies in. So we are handling with the freezers. Then electric saw for the cutting of the bones, for the cutting of the skull is in use. So the electrocution may be occur due to faulty or leakage of electrical plates, wires, leakage from the instrument, and work is when going on the wet condition, it can also be dangerous. Then about the chemical hazards, as various chemicals are being used in the autopsy lab, like formalin, disinfectants, and their spillage over the skin into the eyes will cause irritation, inflammation, or sometimes serious consequences. Then hazards from the ultraviolet light. When UV light is used in the autopsy lab for sterilization of the equipment, particularly when the infectious body is dealt with, then careless usage may cause injury to the staff. That someone don't know that the inside lab, the UV lamp is on and he enters, he can get injured. So these injuries may range from simple erythema to vesicle formation. Now, various infective hazards from the dead body. These are usually by the infectious diseases which are classified as category A, category B, and category C. The infections as advisory committee on various dangerous pathogens of the UK have declared a standard risk autopsies, high risk autopsies. So the category A are the viral infections like HIV, HCV, and hepatitis B virus, and nowadays the corona. So these are highly infectious. Then category B, all infectious diseases like tuberculosis, cholera, hepatitis, plague, they are in category B. And category C, all other miscellaneous like meningitis, pneumonia, encephalitis, they are included in category B. So the knowledge of these hazards help us to devise the preventive measures. Now, talking about the prevention of autopsy hazards, this is most important, the protective clothing, like gloves, like gowns, plastic aprons, and gloves. And gloves should be preferably disposable. If not disposable, then they should be of good quality so that they can be washed, sterilized, and reused. Should be of new and freshly prepared, and should be of proper size. Then the goggles, they should be wide and well covering the eyes. Long rubber shoes to prevent the slipping from wet floor. Now the skill and care, this is important. If the staff handling the dead body is well trained and observing the proper skill, then he can prevent the hazards. Similarly, if the staff is showing a reasonable degree of care, it will again be helpful in preventing the hazards. Now, the hygienic conditions. High standards of hygienic conditions should be maintained. Lab should be washed thoroughly after each autopsy examination. I always talk about that the autopsy suite, it looks like an operation theater. In operation theater, all the protective measures are taken that no infection should be transmitted to the patient which is going to be operated. But in a autopsy lab, it's reverse, that no infection should be transmitted to the autopsy surgeon and staff from the body. So if the dead body was infected, then in addition to washing, the lab should be properly sterilized with UV light. All the instruments and the autopsy table should be washed and disinfected with 10% formalin after every autopsy. And all clothes should be autoclaved. Then all electrical equipments and installation should be properly earthed. They should be regularly inspected for any damage, for any faulty wire, for any leakage. So any fault should be rectified and repaired with due care. And the chemical hazards can be prevented by careful usage and avoiding any spillage. Then the sharp instruments should be handled with extra care. There should be no discussion or demonstration while cutting or when the sharp instrument is in your hand. Now, about the immunization of the staff. Staff should be regularly and properly immunized against all infective and communicable diseases. In spite of all preventive measures, if some accident occur, then the first aid should be provided immediately. The area should be washed with plenty of water and soap regularly. Now, this is about the wound. If the wound is, a person gets wound, that area should be washed with plenty of water and soap. And if it is in the eyes, the antiseptic wash is done. Antibiotic therapy should be given. Now, what is necropsy wound? Any prick, wound, or cut during the autopsy is observed is called necropsy wound. Immediately leave the work, remove the gloves, encourage free bleeding for some time, immunize against tetanus, then wash the area with soap and water, dip it in strong antiseptic solution, and then dressing is applied. And if stitching is required, then refer the person to the emergency department. So the summary of this lecture is that we have learned what are various hazards of autopsy and what are physical hazards, what are chemical hazards, electrical hazards, infective hazards, what is necropsy wound. And we have learned that what are various immunization to be done to the staff and how can we prevent these hazards. So thank you very much. Take care. Allah Hafiz.